Morning, all of you. Today I will discuss about the subject of pathophysiology and topic is congestive heart failure. Learning objectives of congestive heart failure. Based on the based on the content in this chapter. Based on the content in this chapter, the readers should be able to define heart failure, describe the classification system used to define heart failure, explain the physiological basis for the clinical manifestations of the heart failure, describe expected clinical assessment finding for patients with heart failure, explain the standard pharmacological therapies for chronic heart failure and acute expression of chronic heart failure and their rationales. Describe the non-pharmacological therapies for management of heart failure. Define aspects, outcomes for therapeutic management of patients with heart failure. These are the learning objectives of congestive heart failure. Learning outcomes of congestive heart failure. By the end of the lecture, the students should be able to understand. First one is congestive heart failure, classification of congestive heart failure, drugs used in congestive heart failure, mechanism of congestive heart failure drugs, types of congestive heart failure, treatment of congestive heart failure. These are the learning outcomes of congestive heart failure. These are the learning outcomes of congestive heart failure. Congestive heart failure. Definition. Definition of congestive heart failure. Heart failure. Heart failure also known as congestive heart failure. Heart failure means congestive heart failure. Clinical syndrome in which an abnormality of cardiac structure of functions is responsible for the inability of the heart to eject or fill with blood at a rate commensurate with the recruitment requirement of the metabolizing tissues. In which congestive heart failure, the body required the sufficient blood to the particular organ and eject or fill with blood at the rate commensurate with the requirement of the metabolizing tissues. It is frequent endpoint of many of the conditions. It is frequent endpoint of many of the conditions. Classifications. Classification of congestive heart failure. Functional classification generally relies on the Newark Heart Association's functional classifications. NYHA means New York Heart Association. The classes first to fourth are class first is on the basis of New York Heart Association classification of congestive heart failure class first to fourth. These are the classification of congestive heart failure on the basis of New York Heart Association. Class first. Class first. No limitation is experienced in any activities. There are no symptoms from ordinary activities. Class first. No limitations is experienced in any activities. There are no symptoms from ordinary activities. Class second. Slight mild limitations of activity. The patient is comfortable at rest or with mild acceleration. This is the class second CHF. Class third CHF. Marked limitations of any activity. The patient is comfortable only at rest. This is class third CHF. Class fourth CHF. Any physical activity bring on discomfort and symptoms occur at rest. These are the class 4th CHF, congestive heart failure. the American College of Cardiology, ACC. ACC means the American College of Cardiology. American College of Cardiology. American Heart Association working group introduced four stages of heart failure. According to American College of Cardiology, congestive heart failure introduced four stages of heart failure. Stage first, in which stage first patient at high risk for developing heart failure. Stage A, patient at high risk for developing heart failures in the future, but no functional and structure heart disorders. In which stage first, heart failure in the future, but no functional and structural heart disorders. Stage B, Stage B, CHF, congestive heart failure, a structural heart disorder, but no symptoms at any stage. It means stage B, congestive heart failure. Stage C, congestive heart failure, previous or current symptoms of heart failure. Previous or current symptoms of heart failure in the context of an underlying structural heart problems, but managed with medical treatment. This is the stage C, congestive heart failure. Stage D, Stage D, advanced disease required hospital-based support, a heart transplant or palliative care. This is the stage D, congestive heart failure. This is the classified according to American College of Cardiology Association. Stage A encompass pre-heart failure, a stage where interventions with treatment can reasonably prevent progression to avert symptoms. American Cardiology, American College of Cardiology, American College of Cardiology stage first. Stage A does not have a corresponding New York Heart Association class. According American Cardiology College of Cardiology, stage B would correspond to New York Heart Association class first. American College of Cardiology stage C correspond to New York Heart Association class second and class third. American College of Cardiology stage D overlap with National New York Heart Association class fourth. Types of heart failure. Types of heart failure. Types of heart failure and description. Left side heart failure. Left side heart failure. Most common form of heart failure. Fluid may back up in your lungs, causing shortness of breath. In which left side heart failure, fluid are fluid are back up in your lungs, causing shortness of breath, also known as left side heart failure. Right side heart failure often occurs with left side heart failure. Fluid may back up into your abdominal, legs and feet, causing swelling. In which right side heart failure back up into your abdominal, legs and feet, causing swelling. These are also known as right side heart failure. Systolic heart failure. Systolic heart failure means the left ventricle can't contract vigorously, indicating a pumping problem. Left ventricle can't contract vigorously, indicating a pumping problem. This is the systolic heart failure. Diastolic heart failure. The left ventricular can't relax or fill fully, indicating a filling problem. This is the diastolic heart failure. These are the types of heart failure. Epidemiology. Epidemiology of congestive heart failure. Epidemiology is the epidemiology of the congestive heart failure is the leading cause of hospitalization. Is the leading cause of hospitalization in people older than 65 is the leading cause of hospitalization in people older than 65 years. In developing countries, 2 to 3% of the population suffer from heart failure. In developing countries, 2 to 3% of population suffer from heart failure. Heart failure increase with age. According to age, increase the heart failure. Both men and women have similar incidence of heart failure. Both men and women have similar incidence of heart failure. These are the epidemiology of congestive heart failure. However, there are distinct difference between the two genders. However, there are distinct difference between the two genders, like male and female. Women generally develop heart failure after menopause, in which women generally develop heart failure after the menopause. Menopause means absence of periods. These are the stopping the periods means menopause. After menopause, stopping the periods generally develop heart failure after menopause in women. Women tends to become more depressed than men. Women tends to become more depressed than men. Women have similar symptoms. Women have similar symptoms, but the intensity is more pronounced. Women have similar symptoms, but the intensity is more pronounced. Women usually survive a lot longer with heart failure than men. Women usually survive a lot longer with heart failure than men. These are the epidemiology of congestive heart failure. Causes of congestive heart failure. These are the causes of congestive heart failure. Population distribution risk score. Second one is in which ischemic heart disease 62%. 62% IHD ischemic heart disease are congestive heart failure. Cigarette smoking 16% CHF percent by the cigarette smoking. Hypertension, hypertension, high blood pressure 10% congestive heart failure patients by the hypertension due to the high blood pressure. Obesity 8% congestive heart failure patients by the obesity. Increase the cholesterol level in body. Diabetes 3% percent of congestive heart failure by the diabetes due to the increased blood sugar level in the bloodstream. Valvular heart disease VHD, valvular heart disease 2% of CHF patients by the valvular heart disease, much higher in older populations, much higher in older populations. Rare cases of heart failure. Rare cases of heart failure include viral myocarditis. Viral myocarditis means an infection of the heart muscles. Infection of the heart muscles means viral myocarditis. Infiltration of the muscles such as amyloidosis. Amyloidosis means infiltration of muscles. HIV cardiomyopathy. HIV cardiomyopathy. caused by human immunodeficiency virus. Cardiomyopathy caused by the human immunodeficiency virus means HIV virus. Connective tissue disease such as systemic lupus. Connective tissue disease such as systemic lupus erythematosus. Systemic lupus erythematosus. Abuse of drugs such as alcohol, and cocaine. The abuse of alcohol and cocaine cause the congestive heart failure. Pharmaceutical drugs such as chemotherapeutic agents, arrhythmias. Chemotherapeutic agents are used in the treatment of cancer. Anti-cancer drugs are cause the congestive heart failure due to the side effect of chemotherapeutic agents. Arrhythmias. Due to the arrhythmias means disbalance of rhythm of the heart cause the congestive heart failure. These are the causes of congestive heart failure. Obstructive sleep apnea. Obstructive sleep apnea, a condition of sleep disorder. Obstructive sleep apnea is a condition of disorder. Breathing overlaps with obesity, hypertension, and diabetes is regarded as an independent, independent cause of heart failure. Due to the sleep disorder, breathing overlap with obesity, hypertension, and diabetes. These are the cause of heart failure. Acute discompensated heart failure. Acute discompensated heart failure. These are the causes of congestive heart failure. These are the causes of congestive heart failure. Sign and symptoms. Sign and symptoms of congestive heart failure. Left side failure. Left side failure sign and symptoms. Tachypnea. Tachypnea. Increase the breathing rate, also known as tachypnea. Pulmonary edema. Pulmonary edema means accumulation of fluid and electrolytes in the pulmonary veins. This is also known as pulmonary edema. Cyanosis, accumulation of poison, also known as cyanosis. Apex beats, gallops rhythm. Gallops rhythm means disbalance of rhythm of heart. Heart murmurs. Heart murmurs. Heart murmurs divided in two types: aortic stenosis and second one is mitral regurgitations. Mitral regurgitations. Right side failure sign and symptoms: pitting peripheral edema. Pitting peripheral edema, ascites and hepatomegalia. Hepatomegalia means infection in liver due to the infectious agents, also known as hepatomegalia. Jugular vein detentions. Jugular vein detentions. These are the sign and symptoms of right side failure. Backward failure. Backward failure of the left ventricular causes. Backward failure of the left ventricular causes. Congestion of the pulmonary vasculature. Congestion of the pulmonary vasculature. Subdivided into failure of the left atrium, the left ventricular, or both within the left circuit. Dyspnea. Dyspnea means loss of breathing, absence of breathing. Orthopnea. Paroxysmal nocturnal dyspnea. Easy fatigability and exercise intolerance. Cardiac asthma and wheezing may occur. These are the ventricular causes of CHF. Backward failure of the right ventricular leads to Backward failure of the right ventricular leads to congestion of systemic capillaries. Congestion of systemic capillaries due to the clot formation. Peripheral edema or NS, NS Reka, nocturia, nocturia, ascites, hepatomegalia, coagulopathy. These are the backward failure of the right ventriculars leads to. Diagnosis, diagnosis, diagnostics of the congestive heart failure. First one is imagining, second one is chest x-ray, third one is electrophysiology, third one is blood test, or fifth one is angiography. These are the diagnostic tests of congestive heart failure patient. Algorithm, algorithm, algorithms, fragment, Fremingman criteria. Fremingman criteria means presence of at least two of the following major criteria, or one major criteria is conjugation with two of the following minor criteria. These are the algorithms. Major criteria. Major criteria. Cardiomegalia on chest radiography. Cardiomegalia on chest radiography. S3 gallops a third heart sound. Acute pulmonary edema. Acute pulmonary edema means accumulation of water and body fluids in the pulmonary veins. These are the acute pulmonary edema. Proximal nocturnal dyspnea, crackles on lungs, accusations, central venous pressure of more than 16 cm H2O at the right atrium, jugular veins retentions, positive abdominal jugular test, weight loss of more than 4.5 kg in 5 days in response to treatment, sometimes classified as minor criterion. These are the major criteria of CHI. Minor criteria. Minor criteria of CHF. Tachycardia of more than 120 beats per minute. Nocturnal cough. Dyspnea on ordinary expressions. Dyspnea on ordinary expressions. Pleural effusions. Decrease in vital capacity by one third from minimum recorded. Hepatomegalia, bilateral ankle edema. These are the minor criteria of congestive heart failure. Treatment on drugs. Treatment and drugs. Surgery and medical devices. Surgery and medical devices are used in the treatment and drugs. Coronary bypass surgery. This is the treatment of congestive heart failure is coronary bypass surgery. Coronary bypass surgery. Heart valve repair or replacement. Heart valve repair or replacement. Implantable cardioventure defibrillators. ICDs. ICDs means implantable cardioventure defibrillators. Cardiac resynchronization therapy. Cardiac resynchronization therapy, CRT. CRT means cardiac resynchronization therapy or biventricular pacing. Heart pumps. Heart pumps. Left ventricular assist device or left LVADS. LVADS means left ventricular assist device. This is the left heart transplantation. These are the treatment of congestive heart failure. Preventions. Preventions. Lifestyle changes you can make to help prevent heart failure includes Lifestyle changes you can make to help prevent heart failure includes not smoking, not smoking, control certain conditions such as high blood pressure, high cholesterol level, and diabetes. These are the controlling like high blood pressure, high control cholesterol, and diabetes. These are the main criteria for prevention of congestive heart failure like high blood pressure, high cholesterol level, diabetes, in which diabetes increase the sugar level, staying physical activity active, staying physically active, staying physically active, eating healthy foods, eating healthy foods, maintaining a healthy weight, maintaining a healthy weight. Weight is the main criteria for the congestive heart failure. Reducing and managing stress, reducing and managing stress. Due to the reducing and managing stress, low risk of the congestive heart failure. Low risk of the congestive heart failure. References. References. Clinical Pharmacy, 10th edition 2010 by P.N. Benek. P.N. Benek. Clinical Pharmacy and Therapeutics. Clinical Pharmacy and Therapeutics, 5 September 2011 by Roger Walker. Cat Vitlacia. Pharmacotherapy, a physiological approaches. Dysphoria, 7th edition. Essential of Medical Pharmacology. Essential of Medical Pharmacology. Katie Tripathi, 5th edition. Basic and Clinical Pharmacology. Petramji, Putnam and 11th editions. Bang and Dell Pharmacology, 6th edition. Pharmacology and Pharmacotherapeutics. R.S. Shotaskar, 20 editions. These are the references of congestive heart failure books. Multiple choice questions. Multiple choice questions. MCQs. What is heart failure? What is heart failure? Option A condition in which the heart stops beating. Option B, a condition in which the heart cannot pump enough blood to meet the body needs. Option C is a heart attack. Option D is a condition in which the patient experiences chest pain. The right answer is B, a condition in which the heart cannot pump enough blood to meet the body's needs. This is the heart failure. Option question number 2, which is not one of the three types of heart failure, which is not one of the three types of heart failure. Option A is right side heart failure. Option B is left side heart failure. Option C is congestive heart failure. And option D is myocardial heart failure. The right answer is D, myocardial heart failure for the three types of heart failure. This is the right answer is D, myocardial heart failure. What are question next question? What are common signs and symptoms of heart failure? What are common signs and symptoms of heart failure? Option A is shortness of breath or triple breathing, fatigue. Option B is fatigue. Option C is swelling. Option D is all of the above. The right answer is D, all of the above. Question number next. What are risk factors for heart failure? What are risk factors for heart failure? Option A is medical history of heart related disease. Option A is medical history of heart related disease. Option B is wet. Option C is D. Option D is all of the above. The right answer is D. All of the above for the risk factors of heart failure. Next one question. How many adults in the US have been diagnosed with heart failure? How many adults in the US have been diagnosed with heart failure? Option A is 1.3 millions. Option B is 2.4 billions. Option C is 6.5 millions. And option D is 9.6 millions. The right answer is 6.5 millions adults in the US have been diagnosed with heart failure. Option question number next. Which of the following is not a result of activation? Which of the following is not a result of activation of the intracardiac renin-angiotensin aldosterone? Renin-angiotensin aldosterone system. RAAS. RAAS means renin-angiotensin aldosterone system. The option A is cardiac remodeling. Option B is progressive hyperplasia. Option C is progressive hypertrophy. Option D is fibrosis. The right answer is progressive hyperplasia. Next one question. Which of the following is false regarding to role of the vasculature in CHF? Which of the following is false regarding the role of vasculature in CHF? Option A is endotheliums are present vasoconstrictors. Option B is nitric oxides is important in normal vasodilation. Option C is CHF, congestive heart failure causes increased release of natriuretic peptides which originate predominantly from the endothelium. Option D is endothelium release contribute to increase afterload. The right answer is C. Congestive heart failure causes increased release of natriuretic peptides which originate predominantly from the endothelium. Next one question. How many classes of CHF? How many classes of CHF according to New York Heart Association? NYHA, New York Heart Association. Option A is 2, option B is 3, option C is 4, and option D is 5. The right answer is C. 4 classes of congestive heart failure according to New York Heart Association. Next one question. How many classes of congestive heart failure? How many classes of congestive heart failure? According to American College of Cardiology, ACC. ACC means American College of Cardiology. According to American College of Cardiology, classes of CHF, how many classes of CHF? Option A is 2, option B is 3, option C is 5, and option D is 4. The right answer is D. 4 classes of congestive heart failure according to American College of Cardiology. Treatment of congestive heart failure. Next one question is treatment of congestive heart failure. Coronary bypass surgery. Option A is coronary bypass surgery, and option B is heart valve repair and replacement. Option B is heart valve repair and replacement. Option C is Option C is cardiac resynchronization therapy, CRT. CRT means cardiac resynchronization therapy or biventricular pacing. Option D is all of the above. The right answer is D, all of the above, for the treatment of congestive heart failure, like coronary bypass surgery, heart valve repair and replacement. Option C is cardiac resynchronization therapy or biventricular pacing. Option D is all of the above, right answer. These are the multiple choice questions of congestive heart failure. Recall this chapter. Learning objectives. Based on the content in this chapter, the reader should be able to define heart failure, describe the classification system used to define heart failure, explain the physiological basis for the clinical manifestation of heart failure, describe expected clinical assessment finding for patients with heart failure, explain the standard pharmacological therapies for chronic heart failure and acute expression of chronic heart failure and their rationals. Describe the non-pharmacological therapies for management of heart failure. Define aspects outcome for therapeutics management of patients with heart failure. These are the learning objectives. Learning outcomes. By the end of the lecture, the students should be able to understand congestive heart failure, what is congestive heart failure, classification of congestive heart failure, drugs used in congestive heart failure, mechanism of drugs, types of drugs, CHFs, treatment of CHF. Definition. Heart failure, also known as congestive heart failure. Clinical. Clinical syndromes in which a abnormality of cardiac structure or functions is responsible for the inability of heart to eject or fill with blood at a rate commensurate with the requirement of the metabolic tissues. It is frequently endpoint of many of the conditions. These are the congestive heart failure. Classifications of congestive heart failure on the basis of New York Heart Association. Classes of CHF is 1 to 4, class first, class second, class third, and class fourth. These are the classes of congestive heart failure on the basis of New York Heart Association. Next one is American College of Cardiology. According to American College of Cardiology, four stages of heart failure: stage A, stage B, stage C, and stage E. These are the American College of Cardiology for the stages. Types of heart failure. Types of heart failure: left side heart failure, right side heart failure, systolic heart failure, diastolic heart failure. These are the four types of heart failure: left side heart failure, right side heart failure, and systolic heart failure, and diastolic heart failure. Epidemiology: 65% of hospitalization people older than 65 years. In developing countries, 2 to 3% of the population suffer from heart failure. Heart failure increases with age. Both men and women have similar incidence of heart failure. These are the epidemiology. Causes of heart failure: population attribution risk score, ischemic heart disease, cigarette smoking, hypertension, high blood pressure, obesity, diabetes, breast valvular heart disease. These are the causes of congestive heart failure. Viral myocarditis, infiltration of the muscles such as amyloidosis, HIV, human immunodeficiency virus, connective tissue disease such as systemic lupus erythematosus, abuse of drugs such as alcohol and cocaine, pharmaceutical drugs such as chemotherapeutic agents, arrhythmias. These are the causes of congestive heart failure. Obstetric sleepopnea and condition of sleep disorder, breathing over length with obesity, hypertension, and diabetes. These are the causes of heart failure. Acute discompensated heart failure. This is the causes of congestive heart failure. Sign and symptoms. Left side failure, tachycardia, pulmonary edema, cyanosis, apex beats, gallop rhythmic heart murmurs, aortic stenosis, mitral regurgitations. These are the left side signal and symptoms. Right side failure, pitting peripheral edema, ascites and hepatomegaly, jugular vein distensions. These are the sign and symptoms of congestive heart failure. Diagnostic test, imaging, chest X-ray, electrophysiology, blood test, angiography. These are the diagnostic tests of congestive heart failure. Major criteria: cardiomegaly on chest radiography, S3, gallops and third heart sounds, acute pulmonary edema, paroxysmal nocturnal dyspnea, cracked seals on lungs oscillations, central venous pressure of more than 60 centimeter H2O at right atrium, jugular vein detentions, positive abdominal jugular test, weight loss of more than 4 to 5 kg in 5 days in response to treatment. These are the major criteria. Minor criteria: tachycardia of more than 120 beats per minute, nocturnal cough, dyspnea or ordinary exertions, pleural efficiency, decrease in vital capacity by one third from maximum reports, hepatomegaly, bilateral ankle edema. This is the minor criteria of congestive heart failure. Treatments on drugs, surgery and medical devices, coronary bypass surgery, heart valve repair or replacements, implantable cardioverter defibrillators, cardio resynchronized therapy, heart pumps, left ventricular assistance device, heart transplanters. These are the treatment of congestive heart failure. Preventions, lifestyle changes you can make to help prevent heart failure includes not smoking, controls certain conditions such as high blood pressure, high cholesterol and diabetes, staying physical active, eating healthy foods, maintain a healthy weight, reducing and managing stress. These are the preventions. Next, last one is multiple choice questions MCQs. What is heart failure? Option A is the Option is a condition in which the heart stop beating, a condition in which the heart cannot pump enough blood to meet body needs, a heart attack, a condition in which the patient experiences chest pain. The right answer is B, a condition in which the heart cannot pump enough blood to meet to body needs. Question second, which is not one of three types of heart failure? Right. Option A is right side heart failure. Option B is left side heart failure. Option C is congestive heart failure. Option D is myocardial heart failure. The right answer is D. What is common signs and symptoms of heart failure? Option A is shortness of breath or trouble breathing. Option B is fatigue. Option C is swelling. Option D is all of the above. The right answer is D, all of the above. Question number 4. What are risk factors for heart failure? Option A is medical history of heart related disease. Option B is weight. Option C is age. Option D is all of the above. The right answer is all of the above. How many adults? How many adults in US have been diagnosed with heart failure? Option A is 1.3 million. Option B is 2.4 million. Option D is 6.5 millions. Option D is 9.6 millions. The right answer is 6.5 millions. Question number 6. Which of the following is not a result of activation of the intracardiac angiotensin aldosterone system? The option A is cardiac remodeling. Option B is progressive hyperplasia. Option C is progressive hypertrophy, and option D is fibrosis. The right answer is progressive hyperplasia. Question 7. Which of the following is false regarding to role of painkiller in CHF? Option A is endothelial are potent vasoconstrictors. Option B is nitric oxide is important in normal vasoconstrictions. CHF causes increased release of nutrients peptides which originate predominantly from the endothelium. Endothelium release contribute to increased afterload. The right answer is C. How many classes of CHF according to New York Heart Association? The right answer is C. 4. How many classes of CHF according to American College of Cardiology? Right answer is D. 4. Treatment of CHF: coronary bypass surgery, heart valve repair and replacement, cardiac resynchronization therapy, or ventricular passings. The right answer is all of the above. Thank you all of you for the wonderful session. Thank you again.